Hey, let's rock and roll. Hello, everybody. I am beyond the moon excited today to have Dr. Carolyn McMakin with me. Excuse me. Um, oh, I'm just like, I'm bristling with energy and excitement because I read her book, The Resonance Effect, and my feeling reading this book, I maybe got quarter of the way through and I'm like, wow, wow, wow. And by the end, I was like, why doesn't everybody know this? I mean, the work that this woman has been doing is just rocking my world. I already live in the world of frequency. As many people know, I work with the beautiful device Healy and Mag Healy, and just reading her book has brought in so much depth because she brings so much depth into the world of frequency and how frequencies can be used in the healing world. And so I am very, very excited to have her and her wisdom on today. And I'm just going to quick read a little bit of her bio here for you. She developed the frequency specific microcurrent in 1995 and began teaching in 1997. She has a part-time practice treating chronic pain, does clinical research, teaches FSM seminars in the US and abroad. She's lectured at the National Institutes of Health and at conferences on fibromyalgia and chronic pain in the US, Australia, England, Kuwait, Taiwan, and Germany. Her textbook, Frequency Specific Microcurrent in Pain Management, was published by Elsevier in 2010, and Penguin Random House published The Resonance Effect, How Frequency Specific Microcurrent is Changing Medicine in 2017. I am so excited to welcome you, Dr. Carol, to the podcast Wild for Frequency. Thank you so much for being here.
Thank you so much for asking me. I love talking about it.
Well, I do too. And I can't wait to see where we go with this conversation. And even our pre-conversation before has me super, super excited to talk to you. And where I think I want to begin is a little bit in the bigger sense of resonance. And as I said, I wrote an article recently on Substack about resonance, and talking about resonance. I actually believe resonance is a portal to our true nature. It's a portal between science and spirituality in a very practical way. And I feel like you ended your book with this, I'm just going to read the two very short, but I'm going to read it because I feel like you were speaking to this at the very end of your book. And I want to start here. You said, "What is relevant and real and will never fade in the vivid, peaceful, joyous awareness and permanent certainty. There is no separation between you and the energy that is your essence. That essence fuels the stars and lights your life from within. Our essence is energy and resonance. The resonance effect is not just about frequencies that can change tissue and change your life. It is about the resonance that guides you to your heart's desire and your deepest yearning. Listen." Mm.
That's the one.
Like you're speaking to my heart there. Like why I get like so passionate about resonance in my circles. So it at the essence, at the core, this is beyond just healing. I mean, we all want to be pain-free and healthy and all, but we want to live lives that feel resonant, where we're being led to our heart's desire and living our purpose.
We want to lead lives, I'm going to add a one-word correction, that are congruent. When you play a chord on a piano that is harmonious, I'm not a minor fifth kind of guy. Mm-hmm. I like harmony, not discord that has a purpose. Mm-hmm. In a symphony or a piece. What you think, what you feel, I think, actually creates or helps to create your reality, right? You create that which you focus on. I am supportive and I am supported. That is real. Well, I didn't used to be, until I started saying that, until I believed it. And then supportive people showed up in my life, and I support them. And there's a congruity and a harmony in my life now that hasn't ever been there. Hasn't been there. I'd say it started in about 2016. So I finally got it. I got that part done by 2016. And my life feels harmonious, resonant. It's not woo-woo. I am convinced it's physics. And thoughts and emotions have power that affect our neurotransmitters and our cell membrane receptors and our digestion and everything. Mm-hmm. So I totally agree with you. I'm glad you like that paragraph. It's my favorite.
Thank you.
Among many favorites.
There are many good ones. I've pulled out some more I may read later, but that one in particular. And what you just said, that it's, and actually this is another favorite that you said, it's not woo-woo, this is physics. And I'm I'm a former scientist. This is my second career. So I was an ecologist, and I'm a bridge person. And I feel that in you too. You're a bridge person. And this bridging science and spirituality and making it real for people and coming out of the woo-woo into saying, like, no, you can use these principles and frequencies to tap into the God source divine, the greater information field, the great mystery, whatever we want to call it, that is guiding all of us. We can use frequency and these principles of resonance to help guide our lives. I feel like that's what you're saying.
And yeah, and the principles of resonance, I talk someplace early in the book about it. If you have two guitars in a room separated by 6 feet, and you twang the G string on one, in a few seconds, the G string on the other one begins to vibrate and hum because they're tuned to the same frequency, they match. Mm-hmm. If the G string has a piece of paper on it or a stick that's in the way, you twang this one and the other one doesn't hum. There's interference. There's something in the way. Doesn't match. It interferes with the harmony. With FSM, with frequency specific microcurrent, the frequencies are listed. So I got a list of frequencies from an osteopath who bought a practice in 1946 that came with a machine that was made in 1922. And that machine came with a list of frequencies. So there's a list of tissues like fascia, blood vessels, tendons, ligaments, discs, whatever. And there's pages of frequencies about specific pathologies. So if you want a tendon to stop hurting, there's no frequency for stop hurting in the tendon. There is a frequency for torn and broken in the flat tendon that is the pec minor, let's say. And you run that frequency to repair torn and broken in the connective tissue that holds the pec minor to the bone it attaches to. and the muscle relaxes and lengthens, and the shoulder drops back. Well, you just took the piece of paper or the stick of wood off the G string, and now the pec minor is allowed to resonate with its purpose in life, its real self, because you got the interference out of the way. So it works if it's, I learned about it with muscles. I learned about it with emotions. I learned about it with the brain, working on patients. So it's very specific, which is, it took me 5 years and 50,000 patient visits. So 15 to 18 patients a day, 5 days a week, 50 weeks a year for 5 years. And that's how I found out that the frequencies always do what they are described as doing, but they only do what they're described as doing. So if the tendon isn't torn and broken, if it's scarred to the artery, nerve, or vein, you can run torn and broken all you want, it won't work. It's very specific. And it's kind of the same thing in life, right? You were talking about your divine purpose, what you resonate with, where you are at peace, where your soul knows that it needs to go. And it takes you there, and you hit a place where you just stop. And it's like, okay, well, now what do I do? What's stopping me? I think I am supposed to go there. I feel that I should be or want to be there. And there's this wall here. What's that about? So you sit quietly with yourself and you find out, I'm afraid to go there because if I'm successful, people might not like me. And that's what it was like when I was in the 3rd grade. And it's buried in my subconscious. So I didn't know I was afraid to be successful, because when I got an A on that paper, the other kids made fun of me. So there's fear that's stopping me. What do I do? Well, you don't just break through the brick wall. You have a conversation with the 3rd grader that's inside, that's afraid. She's the one, I'm the one at that age that put up the wall that's stopping me. I did that. What appears in your life is what you create out of your history, out of your loves and anxieties. And so you have a conversation. Well, okay, after you got the A on the paper, what happened? Madeline was so mean to me, and I went home and my mom was nice, but she didn't understand. And then I went out, and Madeline had 4 of her friends, and they were all mean to me, and it was awful. And I decided I would never get an A on a paper again. Okay. Is that the way it's worked out? What happened to Madeline? Oh, well, she moved. So is Madeline real? Oh. Is Madeline here now? No. So so you're having a conversation with yourself. I was trained in Gestalt therapy. So you sit your 3rd grade self and your adult self in a chair, and you have this conversation inside your head. And is Madeline there? Look around. No, Madeline's not here. So what is it you're actually afraid of? Oh, well, I'm afraid people will be mad at me if I'm successful. That's understandable. I can understand that you're afraid, but is there anybody in your life now that's like Madeline? Oh, not really. Okay. So what if you imagine that episode with Madeline is different? What do you mean? Well, in your head, visualize that scene where instead of making fun of you, Madeline said, wow, congratulations. I wish I'd gotten an A on that paper. You did a really good job. Show me what you did so I can learn. Oh. And then the fear goes away and the wall disappears because you fixed what was causing the wall to be there and be in your way. So we've learned over time that that's what we do with frequency specific microcurrent. We have people that dig on this psoas muscle with their elbows, their thumbs, these pointy things, knobby things, and almost 100% of the time, the problem with the psoas muscle is that you've had a blow in the back, a kidney infection or a kidney stone that inflamed the ureter, made it stick to the psoas. And what you really need to do is run scarring in the ureter. Well, scarring in the ureter is like Madeline. Scarring in the ureter is what's causing the psoas to be tight, this huge muscle that connects your low back to your hip. And that has turned out to be the reality for everything we treat. You treat the cause. Why are your neck muscles tight? Well, because the upper joints are inflamed and you've got a disc bulge at C5-6. Ah, so do you treat the muscles? Well, you could, but there's not much point. You treat what's causing the muscles. Same thing in life. So starting in 1999, when I started successfully treating fibromyalgia associated with spine trauma, that's how I got to lecture at NIH, pure luck, that somebody that came to me for trigger point therapy on his legs happened to be in charge of the speakers for grand rounds in building 10 at NIH. And so where was I going with that? So I did that lecture and then on to the other lectures. Where was I going with that? What was in the way? Yeah, it comes down to treating the cause. And when the door opens, say yes and walk through it. I don't know what's on the other side. Well, did you, on some level, ask for the door to open? Well, yeah. Okay, then when the door opens, what you need will show up. It won't always look like what you thought it was going to look like, but it's going to be fine. Or the door wouldn't have appeared. There's something there for you to learn or to do. And so you go through. It's been an amazing journey.
And your analogy is so, oh my gosh, I could take this in so many directions. The door that is closed is the scarring or the thing that we've in the physical manifestation that has been put in the way of the flow of energy through the muscle or tissue, right?
Mm-hmm.
And I thought I'd get into this later, but it's so relevant right now. We can back up and we'll go to some of the other questions I had. Like, I really want to know where the list came from or what you know about that. And but because we're on this topic, I'm a biofield tuning practitioner as well. So I've studied with Eileen McCusick, and I work with tuning forks in the field, energetic field. And in biofield tuning, we use tuning forks as a way to what the model is that we have a biofield or an energetic field around the body, and it contains like a vibrational blueprint of our beliefs. And there's emerging science on this. It's not just woo-woo. There's actual real science that CHI is, Consciousness and Healing is leading on biofield, right? But the idea is that you resonate in an area of the field, and it may cause, part of the tissue to release. But what I'm bringing this up is because I'm very curious about what you said before about Madeline and this idea of a belief, an experience we had in childhood that causes us to hold on to an old belief, like I can't be successful because,
people are going to laugh at me.
Are going to laugh at me. Created an energy of fear. And in biofield tuning, we talk about there's a relationship between that fear somehow manifested in the body.
Mm-hmm.
What I'm curious about is for you to say more about that. And when you work with frequency on the body, do you release the belief tied to it? Or do you have to do that separately? Like if you just worked at the frequency level and release the scarring, or I run an emotions program on my Mag Healy, and it, you talk about, you have emotions work, right? And we're releasing anger from the liver. Does that release those traumatic experiences as well? Is it feels chicken and egg to me.
They coexist. So when we treat somebody, at first, 27 years ago, I had one machine in a room with a patient. So all I worked on was, let's say, the physical stuff. And now I have literally 6 or 8 machines on one patient at a time. And the fears, the negative experiences that create certain self-beliefs exist in the unconscious portion of the mind. So my master's is in counseling, and I did clinical hypnosis with the San Diego Society of Clinical Hypnosis when I was 28. Then I got my master's when I was 33. And I did a year of post-trauma hypnosis. And actually all of these experiences exist in the hippocampus. It's an unconscious, or in the midbrain in our world, it's where unconscious memories are stored. So you get molested when you're 3, 4, and 5. You have no memory of it, because when your brain myelinates at 7, it sort of buries all that stuff. Very few of us remember what actually happened when we were 3, 4, and 5. So it's in the unconscious portion of the mind, but the unconscious portion of the mind is what drives the bus. You are guided to co-create, that's a better word, co-create experiences as you go through life based on what that unconscious portion of the mind expects. So we've all had the experience of either ourselves or somebody we know marrying the same narcissistic, alcoholic person again. This is the 3rd one, Andrea. What is up with that? Well, my dad was, and my uncle was. So there's a lot of it is unconscious, and there are ways of getting to the unconscious part, or you can just change physically I am going to change myself into a person who expects a quiet, successful, loving, peaceful way of being. That is me. I am quiet, successful, peaceful, loving, harmonious. That's me now. Well, that isn't what's in my subconscious, but I just created this definition of who I am. Well, this person doesn't pick narcissistic alcoholics. So there's a learning period. And then when we work on patients, there are patients that have had nerve pain or low back pain or whatever for 10 or 12 years. And you actually have to do both. So you treat the physical pain. That's not usually that hard. And then there's a second machine whose job it is to treat the midbrain and the vagus nerve. So the midbrain is the amygdala, the emotional portion of the brain. We have one frequency for that whole cluster in the middle of the skull. The amygdala, the hippocampus, the unconscious part, the thalamus, which kind of directs all the pain traffic to places it needs to go. And it's a relay station. So we treat and quiet that section of the brain down to reduce central sensitization. And we turn the vagus on while we're treating the psoas, the low back, the nerve, the intestines, whatever. So you do both at once. And that's the benefit of having multiple machines, because you can fix the spiritual stuff and you're still stuck with low back pain. And low back pain or nerve pain is a trigger that confirms to the midbrain, see, I told you you deserve to be in pain.
Mm-hmm.
So unless you get rid of the pain first, and that leaves the midbrain being a little bit confused, it's really nice these days to have multiple machines. We use a Precision Care as the treating device. It's any microcurrent device that has 2 channels, like the time waver or whatever, that you can pick. You can treat the peripheral pain, but then you set up a separate machine that does what we call the brain balancing, and treat the vagus nerve in the midbrain. And so you do both because they interact. If you get rid of the pain without changing the midbrain, well, and if you change the midbrain but the pain's still there, the midbrain immediately flips back and said, see, I told you so. So you do both at once. They co-create the reality.
So it feels like you're saying that when you work on both channels, and you can do this with a Healy and a Mag Healy too. Like you could use the Mag Healy with the 2-channel system to work on the pain, and then you could use a Healy to
work on the energetic and the karmic and the energy center and the emotional, whatever comes up.
Right. But it feels like what you're saying is it's like there's a feedback loop and you're interrupting the feedback loop.
Yep. Yeah. Because they co-create.
Yeah.
87% of fibromyalgia and chronic pain patients have a history of having been molested or abused as children prior to the age of 7.
87%?
It's like, it's huge. I may have the numbers slightly wrong, but it's upwards of 80%. There is a history. So on my new patient intake questionnaires, is there anything I should have asked you that I didn't? And then up in the trauma section where you're recording auto accidents and falling off horses and playing volleyball and soccer, and then just right along with that is, have you ever been molested or abused? And nobody's ever asked them that. I always ask. and I'm comfortable asking. And usually there is an answer.
Mhm.
And it's like, and often they will say, nobody's ever asked me, but yeah, okay. What happened? Who was it? How old were you? Okay. And that tells you how sensitized the midbrain is to any external traumatic event. And then you know you need to treat the midbrain. So when someone has been molested, abused, or raped prior to the age of 7, or at any time actually, because it can happen in utero. My mom got divorced when I was 3 months old. Well, that pretty much tells you that mom's stress hormones were really high while she was pregnant with you. And that means that the patient you're working on is more sensitive to any negative external event that happens. So it has a greater impact on them if you could measure them on an objective scale. That's air quotes. If you could measure them on an objective scale, they're more sensitive to that negative external event. And that changes how sensitive they are to, let's say, their low back or ankle pain. So there's always 2 parts to pain. One is how much it hurts, and the other is how much you mind it. So the patient's pain is a 4 or so if it was objective. But how much do you mind it? Oh, it's like an 8. Because somebody will be sitting there upright talking to you, and they tell you their pain is a 10. And then you have to tell them, no, it's not. Because if it was a 10, by definition, you'd be curled up in the corner, sucking your thumb, asking for morphine, and you would not be able to carry on a conversation or sit upright. So let's separate it into how much it actually hurts and how much you mind it. So that's the how much you mind it has to do with the spiritual, energetic, and unconscious portion of the brain. And then there's the physical pain generators that create the discomfort. And if the discomfort is purely emotional, it's really the same thing.
Mm-hmm.
That emotional discomfort starts in the midbrain. The amygdala experiences a sensation which we have learned to identify as anxiety or sadness or grief or anger or irritation or just yuck. And then how sensitive are you and why?
Mhm.
So that's why I'm a terrible therapist. I have a master's and I'm just have no business being a therapist because I like figuring it out. And then I tell the patient what's wrong. And then it's like, okay, go fix it. That isn't how therapy is supposed to work. Like, oh. So
And I'm very mindful when you were speaking about how, you talked about the brain a lot, like it goes back to the midbrain. And in your book, there's a lot of emphasis on running concussion protocols. And I walked away thinking, wow, I hadn't really thought about, for the Mag Healy, for example, running brain harmony. I feel like, I'm pretty good, healthy, but actually, or for people I'm consulting or, providing advice for, I actually came away thinking, well, most everybody probably needs to run this brain harmony and maybe even the thalamus harmony, right?
brain and thalamus. I run it on myself every night. And people will say, every night? And I look at them and it's like, do you watch the news? Did you get in the car and drive on the freeway today? And the bicycle that almost ran in front of you and the car that came a little bit too close when you were turning left. It just resets the nervous system. And that was the model that this osteopath had developed after he got the machine in 1946. He could see what the medulla did, and he developed this model that said concussion in the medulla, and these are air quotes, is kind of what leads to all manner of disease and illness. And okay, I didn't want to have to teach it. It's like, because nobody has ever heard of that model. This is one Dutch naturopath, osteopath from Australia and England who came to Canada, and then California, and then Portland.
Harry Van Gelder.
Harry Van Gelder. And he had this model about concussion in the medulla. Has anybody that's listening to this, or anybody, ever heard of that model? No. So when we'd gotten to the point where it was time to teach the frequencies, to find out if they were reproducible, like, were they actually working, or were our results because I'm a nice guy and the walls in the clinic are pink? It's like, is it real or is it the placebo? And I didn't want to have to explain the concussion protocol to a room full of MDs and physical therapists. So I spent 6 weeks in the clinic, and we didn't run the concussion protocol on anybody, new patients, returning patients. We just didn't run it. And our outcomes just went in the tank. They're just like,
Wow.
Then we started running it on everybody, new patients, returning patients, plus working on the physical stuff. Everything went back to normal.
That's a mic drop.
Yeah, it's like, yep. And then, just because I'm stubborn, I spent another 2 weeks not running it on anybody. And same thing happened. Outcomes just, pain didn't hold, emotions, nothing. It's okay, fine. I give up. I don't understand it. I know it doesn't make sense. So it's best when I teach it to just tell people it's okay if it doesn't make sense, because it doesn't make sense. But I did this thing and I tried not to use it, and that didn't work. So just use it and see what happens.
Amazing.
It is amazing. And that may be the connecting point, and it actually is by way of the vagus nerve. That may be the connecting point between the body and the brain and the energy centers. And as you and I are talking about it, and as the self, because if you get all the junk out of the way, then it's easier for your soul to find its way home. Wherever home is.
Yeah. If you get all the junk out of the way, right? The signaling is that key core signaling at the center, and in the yogic tradition, right? I mean, there's a great focus on the pineal gland, and that's midbrain center of being, essential to, when we work in Kundalini practices, you're bringing energy up. Where are you bringing it? You're bringing it to the midbrain. And in fact, like now I'm thinking about 40 hertz and the way that 40 hertz has been known in the meditation. I know you have a whole chapter on your book about it, but in meditation, it's a key frequency that ignites gamma and brings us into super conscious states, right?
40 hertz reduces inflammation, and inflammation is sort of the prime pathology that gets in the way. Of course, inflammation is, I did a webinar on 40 hertz is what keeps you alive, but it's also what's ultimately going to kill you. So you have to have a balance between just enough, but not too much.
What do you mean it's going to kill you? I don't follow.
Every degenerative disease has as its basis inflammation.
Oh, I see. Inflammation will kill you. I see what you're saying.
Yeah. But
Yeah,
it is also what keeps you alive.
yes. Yeah.
And so there's this balance. And the question is, does that balance exist in the medulla and the vagus? Because the vagus nerve is the one that starts in the medulla
Mhm.
and then has fibers that go down to the spleen and suppress the immune system. When everything's going well and you're happy and at peace, the vagus tells the spleen, it's like, dude, chill out, we're fine. And the spleen goes, okay, you just let me know when there's a cut in your finger, or when a tiger's dragging you through the woods, or you get an infection, or you're mad at somebody, then I can produce enough inflammation to keep you alive to get you through the stressful times. Okay, fine. But right now, I'm just fine now. Okay. And the fun part with FSM is in the last, I think it's only been 8 years, is when I developed the protocol to turn the vagus up, to quiet the trauma in the midbrain that turns it down, to quiet the centers in the medulla that turn it down, and then bring vagal tone up to reduce the heart rate, quiet the immune system. And all of the fibers from the vagus go from the body to the brain and tell the brain, hey, there's infection, stress, or trauma. Well, when you turn the vagus on and take the pathologies out that turn the vagus down in the first place, then the vagus tells the midbrain, dude, I don't know what you're upset about. We're fine down here. Just chill out. Oh, okay. And so it's the balance between the two. And that's where you come to the spiritual part and the physical part. Are we spiritual beings in a physical reality? Or are we physical beings having a spiritual experience?
Mhm.
Some of each.
Mhm.
Oh, wow. I love the look on your face.
It's just like, oh, where do I go with this? There's so much. Okay. Can we go back to the list?
Okay.
I'm really fascinated. What do you know about? I wanted to hear about, just to back up and tell the story a little bit, where this list came from, because there were obviously some amazing people looking at this, didn't just come from anywhere. So where did it come from? And then, because it's really, I think not everybody understands this, to just speak a little bit about what happened in the early 2000s with the early 1900s, with the, what's it called, the
Flexner report.
Flexner report,
Yeah.
and why this type of healing with frequency isn't well known, how it was shut down.
Yeah. Well, starting in probably 1908 or so, there was an interest in the use of electricity, electromagnetism, and frequencies to treat people. And there were probably 7,000, 6,000 medical physicians in the United States and the UK that were doing experiments on developing a frequency that would neutralize X, tuberculosis, inflammation, parasites, whatever. And there were various funky looking devices. The Flexner report came out. Oh, and they had journals like the Electromedical Digest. There was the Pathometric Society, where they would meet in groups and talk about the research and what did what. And then there was another one. And in 1910, the Flexner report came out, and it was sponsored by, I can't remember, because the FDA didn't exist in 1910. It didn't come in until later. But Flexner came out and basically said, well, number one, there's too many medical schools. Number two, they let in too many Black people and too many women. So his recommendation was that there would be fewer medical schools and they would be focused on white male doctors, and that all of these therapies, and that's a scrunchy look on my face for those of you that are listening to this, all of these therapies were unscientific: homeopathy, herbs, nutrition, and these electrical therapies were just hooey. That prescription drugs, patented drugs, and radiation and surgery were to be the tools of medicine. And that flexion was in 1910. Then we had an epidemic in 1915, and then there was another epidemic in 17, and then there was a big pandemic in 19. So that slowed down everything.
And a war.
Yeah. Oh yeah, and the war. Forgot about that. And then so around 1923 to 26, they got more serious about it. And it resurrected itself, and they started pursuing physicians, putting some of them in jail. And the doctors caught on pretty fast and either put the machines on the junk heap or put them in the back room of the clinic and put a sheet over it and said, machines? I don't use a machine. I don't know what those are for. It's like, why would I do that? I read the thing. I'll be good. And then there was the library, Grandpa's library, that had every issue of Electromedical Digest going back to the first one in 1909 up until the last one we found in the rare book room at the Naturopathic College was 1951, before they finally folded. And this list, Harry Van Gelder was an osteopath. He bought this practice in Vancouver, BC in 1946, went in the back room. There was this sheet. He found a list, taught himself how to use it. So he was an osteopath. He adjusted the spine. He was from England, so he didn't know about whatever. So he gave people nutrition. He used homeopathy. He stimulated acupuncture points. He was extraordinarily successful at fixing very difficult conditions. And George Douglas knew about Harry from the Theosophical Society, and because people had heard about Harry all over the Western United States. And George went down and worked with Harry. I think it was in 1981 or 1983 when he went to chiropractic college. And he worked with Harry for 3 months, came back with the list of frequencies written on pieces of binder paper, basically, and stuck it in a drawer. You know how you do. Yeah, I'll remember where I put this, not. And then George and I got together in 1991. He was one of my instructors at chiropractic college. And then I graduated in 94. I was 47. For those of you who ever think it's too late to do whatever you're called to do. So I graduated when I was 47. George and I had been together for some time then. And there was a precision microcurrent. It was an analog microcurrent device that had 2 channels. And he looked at that and he said, that has 2 channels, like Harry's old machine. I wonder if those frequencies would work. And then he went home and scrummaged around in the desk and he found the frequencies. So he brought them to the office. And I was working on somebody with my thumbs for trigger points or knots in the muscles in her lower leg. She was a runner and she changed shoes and it created a strain in a muscle. So she had a little knot in the muscle. And you do what's called ischemic compression. You press in the knot, relieve the pressure, and the blood comes flowing in, and eventually the trigger point goes away. Well, she came in with a pain at a 3 or 4. It went down, and then all of a sudden it went up to a 7. And it's like, ah. So I called George and I said, what do I do? And he said, well, you have a blue box there, set it up so the 2 channels cross, and put 18 hertz on channel A and 62 hertz on channel B. I said, what are those for? And he said, well, I'll tell you if it works. Great. So Yeah, that's a good
I
phase.
love this story.
Yeah.
Riveting.
And so I ran the frequencies and her pain went to 0. And the knot had already disappeared. I got rid of the knot with my fingers. And the frequencies made her pain go away. So I called him back when she left and I said, what did I just do? He said, well, I think you broke a blood vessel with your thumbs because the frequencies were to stop hemorrhage. What frequencies? Well, the ones from the list. What list? Harry's list. There's a list. All right. And about a week later, we started using frequencies on Tuesday and Thursday, my day off, to treat my more difficult patients because I was seeing fibromyalgia and chronic fatigue patients. And he worked with the list up on the counter, looking at the list, assessing what was going on with the patient. And I did the manual hands-on work with the patient and they started to get better. Well, every chronic pain patient you see knows 6 people just like them. And so pretty soon, the next year in 96, I was full 5 days a week. I didn't have a day off. I had 2 kids. And so that's how it started. And I would look at the list, going from what George had told me about the list, and feel with my hands and wait to see what the frequencies changed. After about 5 years and 50,000 patient visits, I finally had to admit that the frequencies did only what they were described as doing, and they only what they were doing, but they always did what they were described as doing. So if you dissolve scar tissue, it was going to dissolve scar tissue. And that was it. So it's ever since then, it's been a matter of listening and thinking about what's wrong with the tissue and the patient. And at some point, because your next question is, where did the list come from? Haha. What? The truth of the matter is, we'll never know. All that is gone. When grandfather died, all that, those little yellow booklets that were on a shelf that were 20 years of electromedical digest. I don't know if you've ever had to clean out your parents' or your grandparents' house. Nobody knew what to do with those. So it's like, yeah, I got 2 weeks to get this mess cleaned up. They were just going out on the trash pile. And it's just gone. Yeah. And it's written in an antique sort of language. The syntax and the kinds of experiments they did, completely different than what we use. So we'll never know. I just had to accept that. I'll never know. My only job is to tell you how to use them now. And the frequencies will prove to us that they do what they are described as doing. And that's it.
Yeah.
And you just have to let go of the fact that you're not ever going to know where they came from. And it honestly doesn't matter. What do they do? And there are systems of frequencies from different systems that are completely different. 40 hertz reduces inflammation in every system of electromagnetic therapies from that period of time, in every system. That one I know. That is, whether it was Ruth Drowned or Abrams or whoever, 40 hertz reduces. And then at MIT, they took mice that had Alzheimer's and they put a little fiber optic cable in their brain. And they made that fiber optic cable blink at 40 hertz. It blinked 40 times per second. And their Alzheimer's went away. It was like, bang. Okay, drilling holes in mice's skull is really tedious. And what if we just showed them 40 hertz? So they put LED lights around their cage that blinked at 40 hertz. And their Alzheimer's went away. These are mice who were bred to die of Alzheimer's. Well, this was probably 5 years ago that the MIT study came out. And the researcher, when she was interviewed on NPR, said, well, we have to be cautious because it doesn't always translate to humans. I don't know if anybody else has noticed, but we haven't heard anything from her since then. They
don't talk about that study. I remember when that study came out.
Yeah. It just went there and died.
I know.
And the challenge is that I believe this is where the rubber meets the road. The challenge is that if we cure things, that's where we run into turf, right? This country spends 1.4, the last time I looked, $1.4 billion on amputations. It spends upwards of 6 billion, well, it's 5.5 billion with a B dollars on wound care prior to the time that they get to amputate the toe or foot. Okay. So the fact that we can fix diabetic neuropathies and heal diabetic wounds in 4 weeks, 6 weeks, if they're really, really bad. I get to do that on a one-on-one basis with our practitioners. I have attempted to have 3 different institutions study that. Can't get it funded. And the funding, if it agreed to fund the study, once we create the template for the study, have it all lined out, we have a budget, we have a plan, all of a sudden the funding institution gets amnesia. And speaking of what is your heart called to do, I have to be comfortable. Like, I have to be comfortable with fixing one patient at a time by teaching one practitioner at a time how to use the frequencies to fix that one patient so he doesn't have his feet amputated. And when it comes to medicine, you have to remember that we're talking about a profession that took 50 years to learn to wash its hands.
Yeah.
That's the list.
Yeah. And we're still living under the Flexner report, shadow, I guess you would say, in terms of, what we can and can't say about frequency and all of, everybody not everybody knows, but this, I have to be very careful with compliance with devices like this and what we can say. We can't say we can treat or cure anything, even though there are incredible testimonials, they're still just testimonials.
Yeah. The plural of anecdote or testimonial is not data.
Yeah.
And it's like, that's just the rule of the game that we are playing. Mm-hmm. We're playing a game.
Yeah. But so we're playing a game, like you just said, though, where the scientific studies, you're there ready to do them, having the framework set up, having the funding to do it. And yet there's
always been something that stops it. So the question is that me? Yeah. Is there a little brick wall in my head that's creating that blockage? Or is it just not time yet? Or is the culture not ready for it yet? Yeah. I don't know. If you can change one person's life, you can change the world. Mm-hmm. And I have to be content with that. Yeah. Just one person. Yeah. And You change that one person and it's like throwing a pebble into a pond and there's ripples. So that's kind of how we roll. And you follow the rules. I don't make any claims. I just do it. What does 13 hertz on A and 60 hertz do on channel B? Well, it takes away trigger points in the psoas. Well, yeah, but what does it do? Not really sure. All I know is trigger points in the psoas go away. If you can control your mouth and not say, well, it's scarring in the ureter is adhered to the front of the psoas. When we take scarring in the ureter away, the psoas releases and the low back pain goes away. Do I have any proof that 13 hertz on channel A and 60 hertz on channel B takes away scarring in the ureter? No. I have zero proof. I can do it, and the low back pain goes away, and the psoas relaxes, and the ureter is now non-tender. Doing it is different than claiming it. You have to be content, at least I have to, with doing it.
Yeah.
That improves one person's life. And it gives me a great day.
Amazing. I'm so glad. I'm so thankful that you went over the history, because I think it is very important for people to understand why we have the system we have, why these incredible technologies like we're talking about are not everyday commonplace in our medical system, that there's a very specific history here. There are people who went to jail, doctors who went to jail. There are instruments that were put in closets because of fear of going to jail. There were, that's the reason. And, I mean, it's a wow. It's horrifying to hear that they were trying to, keep women and Black people out of the medical profession, for example. Like,
Yep.
Wow.
Yeah, that was the part of the Flexner report that surprised me. I knew about homeopathy and herbs and electromedical therapies. I didn't realize that the major goal for the Flexner report was to keep, they literally said the quiet part out loud. There's too many Black people and too many women in medical schools. It's like, okay. Yeah.
So it's incredible to hear and, to understand, where the system that we're clawing our way out of one by one, individual person by individual person that experiences benefits from frequency.
Yeah. And what I would suggest to you and your listeners is don't worry about changing medicine. We're talking about a profession that took 50 years to learn to wash its hands. You can teach an individual MD. 30% of frequency specific microcurrent practitioners are medical physicians. I teach towards medically trained people, MDs, DOs, chiropractors, physical therapists, occupational therapists, acupuncturists, massage therapists. I teach towards that group. Well, that's 30%. That's one guy working at Cleveland Clinic who can use a frequency to reduce spasticity in a child with cerebral palsy. Then the other 5 MDs on the floor look at him and say, "What did you just do?" Well, there's this frequency that takes away spasticity. Frequency? And now there's 7 MDs at Cleveland Clinic that know that frequencies do this thing. And it's, as long as you do it one at a time. And I don't need maybe the fact is you don't need their approval. Insurance companies and drug companies run medicine now. That's just the reality of the game. Well, they're never going to approve frequencies as a therapy. The devices are approved in the category of TENS devices. And insurance pays for TENS devices. pays a physical therapist to use a TENS device. Yay. The devices are fine. You can't make any claims about the devices except the fact that they treat pain. I can say anything I want to about the frequencies because I don't make any claims about them. All I say is, well, I did this with these frequencies and that happened. And then I did it again and it happened again. I've done it 423 times now, and every time it looks like this and you do that, it always happens that way. I can say what I want to as a clinician about the use of the frequencies, but I can't have anything to do with the device company. Does that make sense?
Yeah. Yeah.
Yeah. So
yeah.
thanks,
Navigating the waters of what we can and can't say, and let people try these different things and make up their own minds, I think that's it, try see what's, see what it does for you. I mean, there's nothing like the power of personal change to, I had a friend who turned her on to the Healy device, and her husband had shingles, used it for 2 weeks, and his shingles are gone.
Yay.
Super happy. Yay. That's amazing.
And I had a patient last week that had a Mag Healy and a Healy, and she was ecstatic. She came in and showed me all the things she used on the Healy and showed me about the analysis and whatever. And she still wanted to be treated with FSM because the Healy didn't take care of these 3 things that were going on with her. And so she bought a custom care and she bought a magnetic converter, and they're not mutually exclusive.
Yeah. Yeah, I think so too. And I had my first FSM treatment this week. I really wanted to try it before I interviewed you, and wow, it was fantastic.
Oh, good.
I worked with Jeff Vanderheim.
I know Jeff. Yeah,
give him a little shout out. He was fantastic.
Yes,
loved working with him. I was so delighted that he'd been with you since almost
forever, 20 years.
Yeah, so real depth of experience, and he had like 4 or 5 machines running at once, and
they're addictive.
Yeah, and it was I'm going to go in again and having him work with me on, and maybe this would be something we can talk a little bit about mold. I would love to talk with you about that because it's a deep topic and we can talk for 3 hours about it, but just to touch on it, because it's something I've had too. And I'm clearing it with the support of frequencies and binders.
Take care of your sinuses. Yep.
Yeah, super, super important. But the way that, I know you've had a big journey with mold too. And I want to bring it up because I think it's, becoming epidemic, and it just more and more, it's really there's so many people, and people, as I start to talk about it, say, oh, what do you know about mold and how to treat mold?
Our awareness of it has grown. Thanks. I mean, Richie Shoemaker started it in the 90s.
Yeah.
And then Joe Brewer and Neil Nathan and Roger Bellica on our team. But Neil Nathan is the guy that saved my life. And there's like 25% of the population has an immune system that just can't fight it off. And I'm one of that 25%. It's genetic.
Oh my.
And so for me, the mold colonized my sinuses and colonized my gut and gave me pancreatitis. And the only mold I had was Stachybotrys, was the black mold, trichothecenes, and took away my gag reflex because it paralyzes the vagus. And when the vagus stops working, then the vagus has as one of its jobs to regulate your microbiome.
No, I didn't know that.
I've been around the vagus, and once I was finished finding out what the vagus does, once you see it, you can't ever unsee it. So the vagus has fibers inside your digestive tract that sense the bugs, sense the microbiome. And the microbiome is very pH sensitive. So when the vagus senses the microbiome, well, you need more acid. So the vagus makes the stomach produce more acid to keep the healthy bugs happier. And yeah, the vagus is turned down. It's never completely off, but it's turned down by infection, stress, and trauma. Mold counts as an infection. So I lost my gag reflex. Don't gag at all. Neil looked at it. I went, when you stick out your tongue and your palate's supposed to rise. Mine didn't move. The vagus is the motor nerve that makes your palate rise. Mold turns the vagus down or off. So I had inflammatory problems. My sinuses got infected, my gut got infected, and I'm one of those 25%. So it took me 3 years. I had to remediate my house twice, and it took me 3 years, itraconazole and the binders and FSM, and got rid of it. I went to Taiwan this last September, came home. My digestion was fine, but I wasn't sleeping. My sinuses were stuffy, and I didn't feel right. So January I tested, I picked up 6 species of mold in Taiwan. Just being around the old buildings. So now that was January. And now we are in August? I'm still fighting it. It's like I have that sinus infection. So FSM, the frequencies are not high enough to kill biological organisms. You have to have between 100,000 and 200,000 hertz, 2 channels that cross to kill a biological organism. What FSM does, I think, we have 2 frequencies for mold. What FSM does is it changes cell signaling that is altered by the presence of the pathogen. So there are 5 frequencies for staph, 4 frequencies for staph. Well, we don't kill staph. The frequencies change the cell membrane receptors that were altered by the presence of the staph. So we change cell signaling. We can't kill the bugs.
Well, 2 questions. So this changing the cell signaling, and Jeff and I talked about this during this treatment, that the frequencies reset the cell, so it's really, I think, key for people to understand that the cells are what they're signaling each other. They're taught, that's the language, right? They're talking through frequency. And there's this kind of signaling, and that gets interrupted when we're like exposed to mold or have a trauma. As I'm going to explain back and see if I got this right. So trauma interrupts that cell signaling. And then what these frequencies do is help reset it back to the original signaling that it had.
Yeah, that's the way that's our model for it now. I don't have any genetic proof because the genetic companies that would actually test it want $1 million, $1.5 million, and it's like, yeah, no, that's not going to happen. But the outside of the cell, when you read Jerry Pollack's book, Cells, Gels, and the Engines of Life, and when you read, what's his name, who wrote the Biology of Belief?
Bruce Lipton.
When you read their books, you understand that the outside of a cell is like, the oranges at Christmas that have cloves stuck in them. Okay. So the outside of the cell is full of little cell membrane receptors that are like antenna. And the antenna pick up anything that passes by, a tissue fragment, a bacteria, a toxin, right? And the little receptor, I've got my 2 fingers up for those of you that can hear but not see. I've got my 2 fingers up. And let's say that Staphylococcus floats by, touches this receptor, and it makes it go cattywampus. So the receptor responds, changes its orientation, That receptor is attached to kinuses, that is attached to the DNA, that's attached to the messenger RNA, that's attached to the microRNA, that causes the cell response. So when staph hits this little receptor, the cell response is inflammation. So you get a paper cut, and in 3 hours, that paper cut is red. Well, that's the cells that responded with inflammation when the staph and the little cuts changes the receptor. Drugs, so you could take an ibuprofen, and the ibuprofen works on this little receptor like a key and a lock. It's a mechanical chemical bond between the ibuprofen and the receptor, and it changes the receptor, and that changes the DNA and the messenger RNA and the microRNA, and that stops the cell from producing inflammation. That's how ibuprofen works. It doesn't do anything to the inflammation directly. It does something to the cell receptors and makes them stop producing inflammation. Well, FSM, we think, does the same thing with a frequency, with a signal. So it's the difference between using your car key to open your car door and using your key fob. You can use your key fob, and it opens or closes the car door, and it is specific to your car, not any other car in the parking lot, even though 12 of them are blue Subarus. It only interacts with your car, and it only does the one thing you tell it to. That's what the frequencies do. That's the model we have, because they either work or they don't. And it's the only thing that makes sense. That's one of my goals in life, is to, so I'm going to be 78 in September. And one of these years, about 4 years from now, I'm probably going to retire. And I want to be the oldest PhD student in neuroscience, because I want to find out how it is that we treat nerve pain. Nerve pain is the easiest thing we treat. And it's impossible to treat medically. Phantom limb pain, easy, like stupid easy. One frequency combination, punch a button, walk out of the room, come back 30 minutes later, the patient is stoned. We don't charge extra for that, it's just part of the service. And the pain's gone. Never touched him. Works every time. Anything that has worked 100% of the time always makes me a little bit nervous.
Amazing.
Sciatica, radiculopathies. My hand hurt, my thumb hurts. Well, that's a C6 nerve root. And ow, I do have a 5/6 disc. So we put it on the neck and we put it on your hand, and this thumb pain goes away in 30 to 40 minutes. How's that work? It's not possible. Like, can't be done. And it is the easiest thing we do.
Yeah.
How's that work?
So
yeah, by the time I'm 90, should I be lucky enough to be able to spend 8 years getting my PhD in Costa Rica, I will find out how it is that I want a squid axon, and I want somebody that knows how to tell me to use it. But as far as we can tell, cell signaling and the current by itself, just microamperage current, increases ATP production by 500%.
Yeah.
That's a good thing.
That's amazing. Yeah.
Yeah.
Yeah. I mean, I know, I wanted to ask you. So you said with FSM, with the devices you have, you can't treat mold, but with the Healy, and Time Waver, there are more frequencies available, like up to, a million. So I think with that technology, you can specifically, in fact, I have a mold program that I got from Britt Hanlon from both Healy and Mag Healy that I'm working with, that I believe targets at those higher levels, those frequencies of the specific molds. Is that?
That would be cool.
Yeah.
I don't have any experience with it or haven't people, because I'm, mother of FSM.
Yeah.
People kind of think that I automatically know about every other system around, and I don't.
Mhm.
So I know the basics, which is it takes a lot. It takes really high frequencies to kill a biological organism. So and I know that Healy and Time Waver have the ability to produce frequencies, especially Healy, in the hundreds of thousands. And so it's entirely possible. I just have no experience with it.
Okay. Yeah. Yeah. I believe that's what her programs do. I will check back with her, and I'm going to have her as a podcast next show soon.
Britt is so fun. She's like this little redheaded, sparkly, bubbly person. But the science of it. So I live with one foot equally in both worlds. One is in the alternative community, and the other is in the medical community, because I spent 16 years as a pharmaceutical rep. And you have to balance. So what I would be interested in doing is you do a mold test, and then even if you're using the Healy frequencies, I would you'd have to use the binders. So use the binders and use the Healy frequencies for, let's say, 6 weeks, and then you retest and see if the mold is gone. Did the mold colonization change? Data is a wonderful thing.
Yeah. Yeah. Data is a wonderful thing. I'll have some version of that because I did a mycotoxin test, and I've been working with Healy. So
there you go.
Yeah. So I will at least be able to say something about that. The thing that will be a little tricky is it's not the only thing I've been doing, like I did some FSM, so I'll have to be careful and, but.
Well, we know for sure that FSM does not, FSM does not kill mold.
Okay.
FSM reduces the impact that the mold has in your system.
Yeah.
So mold in the sinuses, mold in the vagus, mold in the gut, mold in the respiratory system. It changes the impact that the mold has on those tissues, but it doesn't kill the mold.
Okay. Well, that
it helps everything else you're doing.
Okay. And it has some really great benefits, but that may be a reason why, maybe Healy is a better tool as a partner for people who are working on clearing mold issues, actually. And what I would just say for anybody listening is just be sure you've got your binders going. Because when I started using the Healy with Brid's programs, and I didn't use binders right away for the first week, and I immediately had a flare up.
Oh yeah.
Yeah.
It's bad.
And then I saw your presentation on mold, and you were hammering on binders, and I was like, oh, I should have known this. I know this.
I know this.
I know this.
You didn't know before, you know now.
Yeah. Yeah.
And then the binders by themselves, especially chlorella, when I first had the black mold, Nathan, I saw Neil, and because the black mold had given me pancreatitis. And so I didn't make enzymes, any enzymes. And Neil said, okay, I want you to take 3 chlorella, 1 charcoal, 1 clay, twice a day. Well, the chlorella package said take 15. So I split the difference and I took 5. And after about 3 days, I was so anxious, I couldn't stand being in my skin. And I called Neil and I said, or Dr. Nathan, and I said, is this supposed to make me feel agitated? He said, how much chlorella are you taking? Oh, 5. How many did I tell you to take? 3. Yeah. Okay, go off of it completely for 3 days. then start at 1 for a week, and then go to 2 for a week, and 3 for a week. And it worked. So the binders really do, when they bind the mold toxins, they are essential to the process. And the way I know now that I'm probably negative for the mold I picked up in Taiwan is I can take a whole set of binders at 4 o'clock in the afternoon and have absolutely no side effects. 4 months ago, when I took the binders, I'd take the binders at 4 o'clock in the afternoon before I left the clinic, and I came home and went to bed by 7:30.
Oh, wow.
Yeah, it's like there's a
Really feel it.
mold is its own separate topic,
Yeah.
and
Yeah.
it's a thing.
It's a
But
thing. Yeah. Maybe I can have you back sometime and we can just talk about mold. We have to.
my favorite topic, honestly, is the vagus nerve.
Yeah.
Once you see the vagus, you can't ever unsee it. It
It-
does everything. It is the only nerve. The vagus is the reason you have saliva.
Mhm.
It has a little fiber that goes to your pupil, like that. It has a nuclei at the back of your throat, sensory fibers at the back of your throat, and then it has nuclei in your spinal cord that is right next to the C3, 4, and 5, keep the diaphragm alive. So these are the motor nerves to the diaphragm. And so you're eating cornbread, let's say, or a hazelnut or whatever, and you get a little crumb in the back of your throat, and you cough instantly before you even feel that there's a crumb back there. That happens because the sensory fibers of the vagus pick up the presence of the crumb, tell the motor nerves, hey, there's a crumb here. She's gonna inhale it and die. And the motor nerves make your diaphragm activate. You cough, you spit out the crumb. All of this happens in about a billionth of a second before your sensory cortex even knows there's a crumb there.
Amazing.
And then it operates every muscle, it's a motor nerve, operates every muscle in your vocal cords except for the one that lets you scream.
Wow.
So when a patient comes in and their voice is really high and their heart rate is 85 and they have, let's say, Ehlers-Danlos, we treat the vagus, we treat the Ehlers-Danlos, we get the body pain down. They get up off the table and their voice is an octave lower. And neck is relaxed, everything. It's just, it operates the esophagus, it operates the lower esophageal sphincter. It's not possible to have reflux if the vagus nerve is operating correctly. And it's just, it has fibers that go to the liver that keep the liver from turning glycogen into glucose. So people that are under a lot of stress, their blood sugar goes up. Vagus is involved in that. Autoimmune diseases, the vagus has as its job to suppress the immune system, T cells and macrophages. So MCAS, autoimmune diseases, food sensitivities, food allergies, joint inflammation. Vagus tells the immune system. So we did a study on scleroderma in England, and scleroderma is scarring in the capillaries, scarring in the connective tissue. And after treating, I mean, we can treat the scleroderma, that turned out to be fairly easy, but I got kind of bored. And I asked the patients, it's like, what happened in your life 1 to 3 months prior to the onset of the first episode of the inflammatory phase of the scleroderma? Every single patient out of the 8 was husband died, lost my job, mom died, had a car accident, fell down the stairs, got a sinus infection, stress, and trauma. Every single one. The vagus turned off. And 4 to 8 weeks later, they had an autoimmune disease. It's just amazing.
This is that connection again between the emotional component of what happened and then how it affects the vagus nerve. And it's so like we have to get to the root. It's beyond just treating the inflammation in the vagus. It's actually going into the thing that was what shut down the vagus in the first place, right?
Yeah, the medulla and the midbrain.
Medulla brain. Now we're back to that. Now we're back to people.
It comes first circle. The vagus sends a message up to the midbrain and says, hey, there's blood outside a blood vessel. There's little fragments of tissue. Or there's a bug. I don't know what the bug is, but there's a bug here. So infection, stress, and trauma, the neurotransmitters go haywire. You've got stress hormones that the vagus minds. And so the vagus tells the brain, hey, there's infection, stress, trauma. The brain sends fibers down to the vagus and says, okay, take a nap. We got work to do. And the vagus shuts itself down. It's never off. Heart rate goes up, blood sugar goes up, immune system gets more active. You fight off the fractured leg, you fight off the bug, you do whatever you have to do. And then in a normal world, the tiger that was dragging you through the woods falls asleep. The vagus goes, oh, thank God. Vagus comes back on automatically. The midbrain calms down. Everybody's fine. Unless you were sensitized prior to the age of 7 or as an adult, and your midbrain perceives threat even when there isn't threat. So then the midbrain stays sensitized. It's called sensitized. It takes much less objective threat to get the midbrain to fire. Midbrain fires, turns the vagus down, and the patient is constantly fighting this inflammation, digestive trouble, POTS, gastroparesis. Everybody thinks they're unrelated, and they all come from exactly the same place. And FSM, so far, if that was the only thing I was able to do with it, it would be magic.
I mean, that's huge. I mean, that must be 80% of it. I'm wagering the people you see have some version.
Everybody, including me. I treat concussion in Vegas every night. I don't even we have data that shows that we can turn inflammation down better than any drug ever created. Reduce lipoxygenase and COX-mediated inflammation by 62% in 4 minutes in every animal tested. Reduce all of the inflammatory cytokines by factors of 10 and 20 times in 60 minutes.
This is what I mean. This is what I'm saying. Like when I read your book and I'm like, why doesn't everybody know this? This is what I'm saying. Like those kind of statistics and those kind of, case studies that you show in your book are jaw dropping.
Yeah. And that's data. And so I'll treat inflammation in the joints in my neck, but systemically, I let my vagus decide. I treat my vagus every single night, and I let my vagus decide how much inflammation I need.
I will be doing the same with my Mag Healy, by the way, because
thank you very much, vagal tone.
Because you've got the Carol. Just I don't know that I said this, but explicitly, but you have programs for those that have a Mag Healy. You were partnered with Marcus Schmiedke, if I'm understanding. And
Time Waiver has been a wonderful partner. That company has ethics and integrity and vision beyond any company I've ever worked with. They've just been wonderful to me. And his vision and what they do with it. And now that they're having to be really careful, they got up above the radar, having to be really careful about regulatory stuff. We still managed a way with the Mag Healy to use specific protocols to do specific things that are really, really useful. So vagal harmony and brain harmony, those two, concussion and vagus. If that's the only thing you ever did, that would help
a lot. And then thalamus harmony. I think you have a thalamus program as well. How does that differ from brain harmony? I'll be wrapping this up soon because I actually have.
It's like you notice that it's 2 o'clock. I did warn you, right?
Yeah, you did, and I could talk so easily for hours more. But how does that program? What does that do? I mean, I want to actually have a thing where we just go through each program, and I want you to tell me what the program does.
So the thalamus, because I can't make medical claims, people have thalamic strokes. So they'll have a stroke or a head injury that affects the ventricles and the thalamus on either one side or both. The thalamus has quarters, so the top half of the body, the bottom half of the body on all 4 sides, but 4 pieces of it. So you have a stroke, and it creates body pain that is untreatable, and it's horrible. There's no words to describe it. It's like somebody held a blowtorch to your body, but you look down and it looks normal. You run thalamus harmony and it goes away. We can't call it thalamic pain. We can't call it thalamic stroke. It's thalamus harmony. And that's all it's good for.
Okay.
That's it.
That's amazing for
Run
those
6
who have that.
Phantom limb pain.
Yeah.
That's another one that the thalamus is good for. And yeah, nerve harmony, low back, neck, those are easy.
Yeah. What about, I'm curious about soft tissue. And then for those who have, there's so much anxiety, depression, what do you recommend?
Soft tissue is somebody throws a baseball and it hits your thigh and you've got a bruise. That's soft tissue. Okay. Doesn't break the bone. It's not a wound, superficial wound on the skin. It's below the skin. It's in the soft tissue. That's soft tissue harmony. That's what it's for. And then what was the other one?
Anxiety or depression? What would you use?
Anxiety and depression is, honest to God, it's the vagus. So the vagus has as its job to increase nitric oxide and circulation to the brain. It directly increases GABA, and GABA directly decreases glutamate. Glutamate is inflammatory in the brain and leads to both anxiety and depression, right? So inflammation in the brain will lead to anxiety and depression. Methylfolate may be why you have inflammation in the brain. You can't methylate folate. You can't methylate B12. You can't phosphorylate B6. You're exposed to a bunch of toxins. But in the meantime, while you're trying to fix these with nutrition, you can use vagus harmony to get the inflammation down. Won't last until you fix the cause, but it helps.
Okay.
And that's,
there is the detox harmony too, right? So that
helps your liver.
Mm-hmm.
And then there is emotional relax and balance that has a bunch of emotional frequencies. And that's been back when I thought that the emotions came from space. And the fact of the matter is you can run an emotional relax and balance. And as long as your brain's inflamed, it's not going to do anything. It helps, but it's like run the vagus first and then run emotional relax and balance.
Okay.
Vagus
and brain harmony too.
Brain harmony and vagus harmony. If the vagus is in harmony, then the whole body is happy.
Yeah. Okay. So do those, but vagus harmony, number 1, maybe brain harmony, number 2.
Brain harmony and vagus harmony.
Yep.
And yeah.
then maybe the emotions or
And emotions.
yep. And then whatever else somebody is dealing with, then maybe they pick a specific thing relative to that, whether
There
that
you go.
right is something like
Yeah.
yeah.
Yeah. And there's nothing wrong with using the Healy in the background. It's like,
Yeah.
ask the Healy what to do. Do what you know to do.
Yeah.
I just do what you know to do. And then ask the Healy what else that it wants to do.
Yeah. And then there's
What's
that.
wrong with that?
Yeah.
We gotta go. It's
We
2:00.
go. I know. I am so delighted to talk to you. I am so appreciative to the conversation and just your work in the world. And you're such a maverick and a pioneer, and you're so delightful to be with. And so, I mean, your depth of knowledge is so obvious. Like, you know, you have so much experience, and I so am grateful for you sharing that with all of us.
My pleasure. It's my way of saying it is you do anything 200,000 times, you better get good at it or get a different job. So I think what I just keep on keeping on, because what could I do that's more fun than this? I mean, really.
And helping
And
people.
then the other thing is the thing that is absolutely extraordinary is that the frequencies will teach you. So I teach this 5-day course, and at the end of 5 days, they're overwhelmed and oh my gosh. And then I said, just wait, do what you know to do and start. The frequencies will teach you what you need to know. That's what's extraordinary to me and absolutely mind-boggling, is that the frequencies do what they are described as doing.
Yeah.
Always.
I mean, I love how you hammer that point of it's going back to the frequencies themselves, that they're like the magic that makes whatever happen.
Yeah. And it's reproducible magic. It's just
yeah,
awesome.
awesome. I definitely want to come take one of your courses. So I
Okay. That'd be fun.
would love to.
Poland. We're going to Poland and Rome.
Oh, wow.
September.
Wow.
Yeah. And then next year, Costa Rica in November.
Oh, maybe I come to Costa Rica. I love Costa Rica.
I've never been there before. I'm going in October for the first time.
Oh, you're going to love it. It's Costa Rica's magic.
That's what I've heard.
Yeah.
There we go.
Yeah. Well, anything last, nugget of something you want to say that we didn't cover?
The only thing I would say is your heart knows where you are to go. Don't be afraid. Listen to it and follow the resonance. What you need always shows up. It doesn't always look like what you thought it was going to look like, but it will show up. And follow the resonance. And then use it to make everything easier.
I love that's the perfect way to end. Follow the resonance. Yeah. And use it.
Go. Thank you so much, Holly. This has been great fun.
Thank you so much, Dr. Carolyn McMakin. Yeah. Just has been so fun, much fun for me.
It has been fun. Do good things, change the world.
Okay. You too. Thank you. All right, to everybody. All right. Bye-bye, everybody. Thank you so much for joining us. Bye. Bye-bye.